What if the one thing you drink tonight quietly determines how clear or how irritated your eyes feel tomorrow morning? And what I'm about to show you may completely change the way you think about nighttime vision after 60. Because somewhere tonight, a senior is reaching for a drink that seems harmless, soothing, even healthy. And by morning, their eyes will feel gritty, tired, blurry, and strained. Meanwhile, another person will do one small thing differently and wake up far more comfortable. I'm Dr. Joseph J. Allen, and I need to tell you this right now. Most popular bedtime drinks people think are helping their eyes are doing the opposite. And the number one drink I recommend is probably not the one you expect. Before we begin, please subscribe to my channel for clear, life-saving health guidance that helps protect your vision every day. Now, here's the truth nobody explains clearly enough. There is no magical bedtime drink that reverses cataracts overnight, cures macular degeneration, or makes aging disappear by sunrise. But there is one drink that consistently supports the two things your eyes desperately need after 60, steady hydration and better sleep. And those two things matter more than most people realize. By the end of this video, you'll know what that drink is, why timing matters almost as much as the drink itself, why some common nighttime favorites sabotage your eyes, and what simple routine helps you protect your vision without wasting money on hype. Let me tell you about Carol first, because her story reveals the mistakes so many people make without even noticing. Carol was 71, retired, organized, and serious about her health. Every night, she made herself what she called her healing bedtime tonic. It was a large mug of sweet herbal tea with honey and a splash of fruit juice. She believed she was doing something gentle and nourishing before bed. But almost every morning she woke up rubbing her eyes. They burned. Her vision looked hazy for the first half hour of the day. She thought it was just age. She thought it was normal. What she didn't know was that her nighttime routine was setting her eyes up for dryness, poor sleep, and unstable morning comfort. Here's what almost nobody talks about. Your eyes are incredibly vulnerable overnight, especially after age 60. Tear production tends to decline as we age. The quality of the tear film can worsen. Some people sleep with their eyelids slightly open. Some use fans, air conditioning, or CPAP machines. Many are taking medications that dry out the mouth, nose, and eyes. And while you sleep, you aren't blinking to refresh the eye surface the way you do during the day. So, the nighttime window becomes critical. If your body goes into that window dehydrated, overstimulated, or dealing with sugar swings and fragmented sleep, your eyes are often the first place you feel it in the morning. That's why the right drink matters, but not for the reason most people think. Now, before I reveal the number one drink, we need to talk about the drinks that fool people the most. Because if you understand why the wrong ones backfire, the right answer becomes obvious. The first trap is anything sugary before bed. Juice, sweet tea, hot chocolate, flavored milk drinks, powdered sleep mixes loaded with sugar, even those immune drinks people think are healthy. They may taste comforting, but they can work against stable overnight physiology. If you're someone whose blood sugar runs high, or even someone drifting toward prediabetes and doesn't know it yet, that bedtime sugar load can make the night rougher and the morning blurrier. And that matters more than most seniors have ever been told. Let me tell you about Frank. Frank was 68, and every single night, he drank a tall glass of orange juice because he'd heard vitamin C was good for the eyes. Sounds reasonable, right? He figured he was protecting his vision. But every morning, he'd wake up thirsty, foggy, and complaining that his eyesight felt off until breakfast. He thought maybe cataracts were suddenly getting worse. He thought maybe he needed stronger glasses. But when we looked more carefully at his habits, the pattern was obvious. It wasn't just the juice. It was the timing, the sugar, the extra nighttime bathroom trips, the broken sleep, and the fact that he was mistaking a routine problem for an irreversible one. The solution started with changing the drink, not changing his glasses. And here's why that matters medically. High glucose can temporarily blur vision by changing fluid levels and causing swelling in the tissues that help your eyes focus. And over time, poorly controlled blood sugar can damage the tiny blood vessels in the eye. That's one reason bedtime sugary drinks are such a bad gamble, especially after 60, when diabetes and prediabetes become more common. Your eyes do not need a nighttime sugar roller coaster. They need stability. They need a calm internal environment. They need a night of sleep that isn't interrupted over and over. When people tell me they want one drink that helps their eyes, I always start by asking what they need to stop drinking first. Because many of the biggest eye boosters sold online are really just sugar in disguise. Now, let's talk about another bedtime favorite people defend with their whole heart, alcohol. A little wine, a nightcap, a splash of whiskey and tea, something to relax the nerves. I understand the appeal. After a long day, a drink can feel like a ritual, like comfort, like relief, but your body doesn't treat it that way. Alcohol does not hydrate you. It can make dehydration worse. It can break up your sleep. And broken sleep matters for the eyes more than people realize. If you already struggle with dry eye, morning irritation, or that scratchy, sandy sensation when you first open your eyes, a bedtime drink that interferes with both hydration and sleep is not helping you. It's setting the stage for exactly the symptoms you're trying to escape. I remember a patient named Janet, 74 years old, who told me, "Doctor, I swear red wine helps me sleep." But here's what was really happening. She would fall asleep quickly, yes, but she wouldn't stay asleep well. She woke up twice a night, sometimes 3 times. In the morning, her eyes felt dry, her lids felt sticky, and she thought she needed stronger lubricating drops. What she actually needed was to stop sabotaging the second half of her night. Once she replaced that nightly wine with a much simpler routine, her sleep steadied. Her eyes felt less irritated on waking. And for the first time in months, she stopped assuming every bad morning meant her vision was permanently declining. That's the danger here. People blame aging for problems their bedtime habits are quietly creating. And there's something else I need you to understand before we go further. Sleep and dry eye can make each other worse, which means a bad nighttime drink can create a vicious cycle. You sleep poorly. Your eyes feel drier. Your eyes feel drier, so you become more uncomfortable overnight. Then you wake up tired, rub your eyes all morning, maybe use screens too soon, blink less, and carry that irritation into the next night. That cycle can go on for months. So, when we are deciding on the best bedtime drink for eyesight and vision after 60, we are not just asking, does this contain vitamins? We're asking a much better question. Does this support hydration without disturbing sleep? Because if the answer is no, the drink is already disqualified. Now let's talk about tea and coffee, because this is where people get confused. They hear that caffeine may increase tear production in some small research settings, and suddenly they think evening coffee is somehow a dry eye treatment. No, that is exactly how people get misled by half-truths. Even if caffeine has some interesting effects on tear production, that does not make caffeinated drinks the ideal thing right before bed, especially if they keep you from sleeping well. A bedtime drink has to be judged by the whole picture, not one isolated effect. If it wakes you up, increases bathroom trips, fragments sleep, or makes you toss and turn, it has failed the bedtime test. Your eyes benefit from a rested, stable body, not a stimulated one. This is also why I want to protect you from the hype around expensive vision drinks, powders, tonics, sleep elixirs, berry concentrates, exotic mushroom blends, collagen eye formulas, all of it marketed like there's a secret doctors are hiding from you. There isn't. In fact, research looking at beverage intake and dry eye does not support the fantasy that one special drink cures dry eye symptoms. And studies on water intake do not prove that simply drinking more and more water magically fixes the problem either. That's important because what works in real life is not excess. It's smart balance. The right drink is not powerful because it is exotic. It's powerful because it does the least harm while supporting the physiology your eyes depend on overnight. So here it is. The #1 drink to have before bed for healthier eyesight and vision comfort over 60 is plain water, in a small amount at the right time. Not a giant bottle, not a liter on your nightstand, not ice cold, chugged at the last second before you lie down. Plain water, modestly, intelligently, and ideally before that final 2-hour window gets too close to bedtime. I know that sounds almost too simple after all the hype online, but simple is exactly why it works. Water does not spike blood sugar. It does not add alcohol. It does not bring extra caffeine. It does not pretend to be medicine. It simply supports the hydration your body, your tear film, and your overnight comfort depend on. But wait, because this is the part most people get wrong. Once they hear water, they overdo it. And that creates a whole new problem. They start drinking huge glasses right before bed, then they're up at midnight, 2 a.m., 4 a.m., or shuffling to the bathroom, turning lights on, struggling to fall asleep again, and waking up exhausted. And remember what I told you. Your eyes need hydration, yes, but they also need uninterrupted sleep. If you destroy the sleep part while chasing the hydration part, you have defeated yourself. That's why the best bedtime water strategy is not more. It's enough. Enough to avoid going to bed dry and thirsty, but not so much that you flood the night and spend it waking up. That distinction is everything. Eleanor taught me this lesson beautifully. She was 76, and once she heard hydration mattered, she became determined to do it perfectly. Every night, she drank a massive bottle of water after dinner because she thought she was protecting her eyes. But she wasn't sleeping. She was urinating 3 or 4 times a night. Her mornings were miserable. Her eyes felt tired. Her body felt drained. And she told me, "Doctor, I'm doing everything right. So why do I feel worse?" Because she was solving the wrong problem in the wrong way. We moved most of her water earlier into the day. If she wanted something in the last couple of hours before bed, she kept it to a few small sips or less than a glass. That single change helped more than all the expensive supplements she'd bought. Now, let me be very clear because this point matters. I'm not telling you water cures cataracts. I am not telling you water reverses glaucoma. I am not telling you water stops macular degeneration. And anybody who promises that is selling fantasy. Serious age-related eye disease requires proper diagnosis, regular dilated eye exams, and in some cases, specific treatment or supplements like AREDS 2 for the right patients. The reason plain water wins the bedtime category is not because it is a miracle. It wins because it is the safest, cleanest option for supporting overnight comfort and reducing avoidable sabotage. That is a very different claim, and it is the honest one. And honesty matters, especially when people over 60 are targeted by promises that sound comforting but aren't medically real. I once had a gentleman named Walter, 72 years old, bring me a powdered night vision recovery drink he'd spent a small fortune on. It had berries, sweeteners, herbs, trendy ingredients, and language all over the label about repairing the eyes while you sleep. He wanted to know if it was the secret to preserving his sight. I read it, looked at him, and asked one question. How much sugar is in this? He blinked. He hadn't even checked. That's how these products get people. They distract you with words like antioxidant, detox, cellular, advance, and repair while ignoring the basics that actually matter. Walter didn't need a miracle powder. He needed better sleep, steadier hydration, a real eye exam, and a bedtime habit that wasn't making his mornings worse. Now, why does plain water help at all if it doesn't cure disease? Because the surface of the eye depends on a healthy tear film. And dry eye symptoms commonly include burning, scratchiness, redness, light sensitivity, and blurry vision. If you go into the night feeling parched, if your home is dry, if your medications already reduce moisture, if your sleep is fragmented, your eye surface often pays the price. Plain water supports the body without adding extra problems. It doesn't mean more water is always better. It means the cleanest bedtime choice is the one least likely to trigger sugar swings, sleep disturbance, or dehydration. For many seniors, that shift alone is enough to make mornings more comfortable and vision feel steadier when they first wake up. There's another group I want to mention because they often feel confused and overlooked. People with sleep apnea, CPAPUs, anxiety, depression, or medications that dry the eyes often wake up convinced they have rapidly worsening vision when part of the problem is overnight eye surface stress. I've seen this over and over. The person thinks, something terrible happened to my eyesight. But what actually happened is their night was too dry, too fragmented, too stimulating, or too dehydrating. In those people, the right bedtime drink becomes even more important because you want to avoid adding one more layer of trouble. You want calm. You want simplicity. You want the body entering sleep in the best possible state, not battling sugar, caffeine, or alcohol on top of everything else. Robert was 69 and used a CPAT machine faithfully, which was good. But every night, he also drank a mug of strong tea because he liked something warm while watching television before bed. Then he wondered why he felt dry-eyed and restless in the morning. Part of the issue was CPAP-related dryness, yes, but part of it was that his last drink was stimulating too close to bedtime and not helping him sleep deeply. We changed two things. He addressed mask fit with his sleep specialist, and he swapped the tea for a small amount of plain water earlier in the evening. Not glamorous, not viral, but within a couple of weeks he told me, my eyes don't feel like sandpaper at 6 a.m. anymore. That's what real progress sounds like. Quiet, boring, and effective. And here's the trap that catches so many people online. They search for best drink for eyesight, and the internet gives them blueberries, beet juice, turmeric milk, carrot smoothies, green powders, berry tonics, one miracle after another. But bedtime is not the same as daytime nutrition. Nutrients matter. Absolutely. Vitamin A matters. Omega-3 intake matters. The right people may benefit from AREDS 2-type supplementation for age-related macular degeneration progression. Good food matters enormously across the whole day. But the bedtime question is narrower. You are choosing what to put in your system during the last stretch before sleep. At that point, the smartest goal is not stuffing in more ingredients. The smartest goal is avoiding anything that disrupts hydration, blood sugar stability, or sleep quality. So if you're asking me, Doctor, what exactly should I do tonight? Here's what I tell my own patients. Finish most of your hydration earlier in the day, not all at once, late at night. In the last 2 hours before bed, avoid alcohol, juice, and tea if those trigger bathroom trips or poor sleep for you. If your mouth feels dry, if you need to take evening medication, or if you simply don't want to go to sleep thirsty, have a small amount of plain water. Small sips are fine. Less than a full glass is often enough. That way, You go to bed comfortable, not parched, but you also reduce the odds of turning the whole night into a bathroom schedule. Your eyes benefit when the rest of you sleeps like it's supposed to. Now, let me tell you about Maria because her story is one I think many of you will recognize. Maria was 73, and every morning, she woke up with blurry vision for about 20 minutes. She was terrified. She thought it meant macular degeneration had suddenly accelerated. She thought blindness was coming fast. But when we reviewed her evenings, we found a routine stacked against her. She drank sweetened chamomile tea, had a little dessert, fell asleep in a room with a ceiling fan on high, and woke up twice a night. Of course, her eyes were unhappy in the morning. We simplified everything. Lower sugar, less late fluid, small plain water if needed, better room humidity, more consistent sleep. Her mornings improved dramatically, not because we discovered magic, but because we removed avoidable stress. I also need to say something important for those of you with diabetes, high blood pressure, or a family history of eye disease. A bedtime drink is not a substitute for monitoring the conditions that silently steal vision, especially after 60. High blood sugar over time can damage the blood vessels in the back of the eyes. High blood pressure matters too, and some major eye diseases don't cause symptoms early. That means you can feel fine while something serious is developing. So, yes, choose the smarter bedtime drink, but do not confuse symptom relief with complete protection. If you haven't had a comprehensive dilated eye exam, that matters far more than any tonic on your kitchen counter. Bedtime habits help support comfort. Exams help protect sight. You need both perspectives, not just one. Let's make this practical because I want you to actually use this tonight. If you're thirsty before bed, don't panic and don't overcorrect. Just choose the cleanest option. A few sips of plain water may be all you need. If you take nighttime pills, use water, not juice. If you're reaching for something relaxing, remember that relaxing and helpful for your eyes are not always the same thing. If the drink contains sugar, alcohol, or enough caffeine to affect sleep, it probably doesn't belong in that final stretch before bed. And if you struggle with nocura, swelling issues, heart failure, kidney disease, or fluid restrictions, then this conversation becomes more personal, and you need to follow the plan your own doctor has given you. One-size-fits-all medicine is dangerous medicine. There's one more subtle point people miss. Many seniors don't actually need a special bedtime drink at all. They need better daytime hydration. That's the real issue. And when they fix it, the night becomes easier automatically. If you drink almost nothing all day and then try to cram your fluids into the hour before sleep, your body pays for that mistake overnight. Better strategy, spread hydration throughout the day. Drink with meals, drink after activity, and let the bedtime window be the place where you fine-tune comfort, not compensate for neglect. The best bedtime water routine only works well when the rest of the day makes sense too. Otherwise, you're using the last 10 minutes of the day to solve a problem you created over the previous 14 hours. That's exactly what happened to Louise. She told me she hated water, forgot to drink all day, and then got serious about hydrating for her eyes at 10 p.m. with a huge tumbler beside the bed. The result: poor sleep, dry mornings, frustration, and total confusion. Once she began drinking regular amounts earlier in the day, she no longer needed those giant nighttime fluids. At bedtime, she only needed a little water if she felt dry or had medicine to take. The next morning, she noticed two things: fewer bathroom trips and less irritation when she opened her eyes. That is such a common pattern that I want you to really hear it. The bedtime drink matters, yes, but the bedtime drink works best when it's the final adjustment, not the emergency rescue. And if you're wondering about warm milk, let me answer that too. Warm milk may be soothing for some people, and if it helps you sleep and doesn't bother your stomach or blood sugar, it may be reasonable in some cases. But it is still not my number one recommendation for the eyes specifically. Why? Because plain water is cleaner. It is simpler. It carries less baggage. Once you start adding calories, sugars, flavorings, chocolate powders, honey, or other extras, you move away from support and back toward complication. When people want a clear answer, I give them the clear answer. The winner is not the most exciting drink. It's the one least likely to interfere with the things your eyes need overnight. And over, that answer comes back to water. Now, let me say something that may surprise you. Sometimes the biggest improvement doesn't come from what you drink. It comes from what you stop doing after the drink. No TV in bed with bright light blasting your eyes, no endless scrolling, no fan pointed directly at your face, no sleeping in an overheated room, no ignoring eye dryness until it becomes your new normal. The drink is one piece of a nighttime eye routine. A good one, an important one, but still one piece. The reason I emphasize it so strongly is because it is one of the easiest things to change tonight. And when a change is easy, inexpensive, and medically sensible, I want you to know about it. You don't need a wellness budget. You need better decisions in ordinary moments. I'm going to bring all of this together with one final story because I think it captures the whole lesson. Susan was 70, sharp, independent, and quietly scared. Every morning her eyes felt dry and her vision seemed dimmer for a while. She'd started worrying about losing her independence, her ability to drive, her ability to read the labels on her medications. She was drinking a sweet sleep tea at night, sometimes following it with a little wine if she felt tense. She thought she was taking care of herself, but her sleep was broken and her mornings were getting worse. We changed her evening routine. More hydration earlier in the day, no sugary bedtime drink, no alcohol, small plain water if needed, better follow-up care. A few weeks later, she said, "I feel calmer because I finally understand what's happening." That last part matters more than you may realize. Understanding restores control, and control reduces fear. When your eyes feel different after 60, it's easy to panic. Every blur feels permanent. Every dry morning feels like decline. Every online ad promising vision repair while you sleep starts sounding believable. But once you understand how much the eye surface, hydration, sleep quality, blood sugar, and bedtime habits influence what you feel in the morning, you stop being so easy to scare. You become harder to manipulate. You stop buying nonsense. You start making clean, sensible choices that actually support your health. And that is exactly what I want for you. Not hype, not false hope, just clear, useful truth you can act on tonight. So here's the takeaway I want burned into your mind. If you want the #1 bedtime drink for healthier eyesight and vision comfort over 60, choose plain water. Keep the amount modest and don't wait until the last second before sleep. Avoid turning bedtime into dessert. Avoid turning it into a nightcap. Avoid turning it into a caffeine ritual. Your eyes do best when your nights are boring, steady, hydrated, and restful. And if your vision is changing in a persistent way, do not sit at home trying beverage after beverage while something important goes undiagnosed. Use the smart drink, yes, but also get the proper exam. That combination is far more powerful than any miracle claim you'll hear online. If this video helped you, subscribe to the channel and share it with someone over 60 who still thinks the answer to eye health comes in a flashy bottle. Because sometimes the best advice is the simplest advice. Protect your eyes, protect your sleep, respect your blood sugar, keep your hydration steady. And remember, the goal is not to find the most exciting drink on the internet. The goal is to wake up with eyes that feel calmer, clearer, and less stressed because you stopped making nighttime choices that quietly worked against you. Take good care of yourself, and I'll see you in the next.